Doctors have been using antibodies from COVID-19 survivors to treat those who are critically ill. Now a clinical trial is underway here in Houston to see if a convalescent plasma can be used to prevent people from getting sick in the first place. Stephanie Whitfield has more on the therapy doctors hope will drastically reduce hospitalizations.
When someone's infected with COVID-19, their body makes antibodies to fight the virus. Since early in the pandemic, doctors have used antibody-rich plasma from survivors to treat the critically ill. But now researchers want to know if that convalescent plasma can be used preventatively too.
We think that this could be potential groundbreaking therapy if successful.
Dr. Bella Patel with UT Health says 2 new clinical trials are happening in Houston. One involves treating people with mild or no symptoms as soon as they test positive.
By giving them the antibodies, could we potentially prevent the infection from setting or perhaps even decreasing it so there's no clinical symptoms?
The second trial will treat high-risk patients preventatively. Think seniors or people with underlying conditions or someone who's been directly exposed to the virus.
So a healthcare worker who's taking care of a patient who they didn't realize was positive.
In those cases, doctors want to see if antibody-rich plasma can stop that person from ever feeling sick. Even better, prevent them from getting the virus at all.
Could it be that anytime a coworker is sick, everybody gets their plasma shot to try to prevent disease?
20 local patients will be part of each study that's being led by Johns Hopkins University. UT Health is the only site in Texas. And if this treatment works, doctors hope it'll substantially decrease the number of people admitted to the hospital. Stephanie Whitfield, KHOU 11 News.
Thank you, Stephanie. An important element of this treatment is having enough plasma. Doctors encourage anyone who's recovered from COVID-19 to donate. We'll have information on how you can do that on KHOU.com.